They're definitely impacting healthcare real estate decisions much more than in the past, whether internally with the hospital C-suites or them reaching out to firms like Jones Lang LaSalle to help them become much more profitable and more efficient in their real estate. What we're seeing right now is really the perfect storm. Is operating costs are increasing, the regulatory environment is becoming more stricter, patients are becoming older, which leaves them to go into Medicare from their commercial payers, and the reimbursements are decreasing. So they're seeing this compression of margin. So even though they were already working on very thin margins, it's becoming more and more difficult to stay profitable. So they're looking at their real estate much differently because it is such a huge line item on their balance sheet, probably the second, third, or fourth largest line item, and their operational costs are a huge burden on their balance sheet. So they're seeing opportunities to understand their real estate better. What do they own? What are their leases? Do they need to develop? Do they need to deploy capital in certain areas? So big picture, they're looking significantly at their real estate to solve some of their margin and profitability issues. I think there's definitely many macro and micro issues unique to Los Angeles, but at the end of the day, the entire country is facing significant challenges as it comes to healthcare and healthcare reform and how hospitals stay profitable and also take care of their patients. Los Angeles is a unique microcosm in itself, very unique socioeconomic and demographic groups. But at the end of the day, as I mentioned before, like anywhere else in the country, there's significant changes and pressures from the outside world, and hospitals, many of them depending on how much seismic upgrades and activities they've already accomplished, might have to continue with the SB 1953 OSHPD rules. Many are still going to be going out into the ambulatory outpatient market, focusing on wellness and focusing on rehab, long-term care, so more up and downstream of the hospitals. Kind of the focus is get out of the hospitals and find a much lower cost of care to do the same type of treatments they were already doing in the hospitals, but do it in an outpatient setting, which they can do it quicker and not as expensive. The easy, quick answer would be no. We have about 30 million plus individuals coming online through healthcare reform, but that doesn't necessarily translate exactly to space needed for 30 million more people. It's a very unique demographic, and most will be on Medi-Cal and have unique disease states and experiences with our healthcare system. And the hospitals are going to be doing care much differently in the future as opposed to now. So although there will be some growth needs to respond to that new increase in patient mix, I think still is how are those hospitals going to be servicing those new patients and the different types of patients, whether it's the new 30 million or the aging demographic that go into Medicare that might have different disease states because of their age. But at the end of the day, these hospitals will have to respond and adapt differently, specifically to those needs.